Today I'll be discussing the fetal effects of COVID-19, and I've subtitled it What We Think We Know. And that's because the data is quite sparse at the moment and the existing data isn't very robust. But nonetheless, I think you'll enjoy this topic. So just for some background, COVID-19 emerged at the end of 2019 in Wuhan. This is in the Hubei province of China. And COVID actually stands for coronavirus disease. It's caused by the SARS-CoV-2 encapsulated single-strand RNA virus. On the 11th of March 2020, the WHO declared COVID-19 a pandemic, and many countries have responded, including our own, by restricting freedom of movement and limiting non-emergency health care. And this includes antenatal care at times. Currently, there have been about 105 million cases worldwide with 2.3 million deaths, and we're still counting. The Business Standard published an article about 5 days ago, which they referred to the emergence of COVID-19 as a convoluted river of emergence. So scientists are currently trying to investigate the origin of COVID-19, and it seems like there are some controversies. Firstly, there seems to be a lack of a clear pathway from bats to humans. And some early cases amongst humans are not linked to the wet market, the one pictured here. Although the wet market seems to play an integral role, the exact details are still unclear. So if we look at the effects of COVID-19 and pregnancy, we know from American mortality and morbidity data that 8% of pregnant women will develop severe COVID disease and 1% will be critically ill, and that the risk of severe COVID-19 may be higher during pregnancy. Risk factors for severe COVID, however, in pregnancy are similar to the general population. And essentially, it's been described as a complex immune response in an already altered physiological state. At our center, we've seen 19 maternal deaths in the first and the second wave already. So moving slightly further away from COVID-19, but staying in line with things that come from China, this is my dog, Penelope, or Penny for short. And pugs were actually bred to be companions to ruling families in ancient China and were popular in the imperial court during the Song dynasty. They were bred to look like a Chinese dragon, the one pictured here, and they were highly valued by Chinese emperors. They lived in absolute luxury, guarded by soldiers, and the breed has retained its affectionate behavior towards their owners, as I can attest. So maybe we must start our understanding of COVID-19 in pregnancy by looking at other respiratory viruses in pregnancy, particularly other coronaviruses. And you've probably heard of SARS, severe acute respiratory syndrome, and MERS, Middle Eastern respiratory syndrome, before. Pregnant women and their fetuses are at high risk of complications from these coronaviruses and were thus identified as a vulnerable group in this pandemic. MERS was absolutely devastating for pregnant women, with a maternal mortality of 40%, preterm birth at less than 34 weeks of 33%, perinatal death of 33%, and there were no described cases of vertical transmission. In terms of SARS, preterm birth at less than 34 weeks was 12%, preterm pre-labor rupture of membranes was 12.5%, as well as intrauterine growth restriction. Perinatal deaths were 10%, and there were no cases of vertical transmission described. So staying with respiratory viruses in pregnancy, H1N1 or swine flu is particularly well studied, and it showed maternal mortality of 8%, with preterm birth at less than 37 weeks of 30%. And they found that pregnancy was actually an independent risk factor for ICU admission and death, similar to what we are seeing in this pandemic. seasonal influenza, the one we all get every year, has shown to have a significant increase in small for gestational age babies, preterm birth, perinatal mortality, and associated congenital abnormalities, specifically cleft palates, neural tube defects, and congenital heart defects. And then we shouldn't forget about the long-term neurological sequelae in the fetus. These fetuses are at increased risk of bipolar mood disorder and major depressive disorder, as well as schizophrenia and autism. So if we examine the placenta and viral infections, the placenta is usually a very effective barrier in preventing the spread of pathogens from the mother to the fetus. But certain viruses have the ability to overcome this barrier, usually with devastating effects to the fetus. And I'm specifically referring to CMV, HSV, Zika virus, and in our setting, HIV. The maternal symptoms are not always equal to the severity of the fetal effects, and usually transmission and severity depends, at least in part, upon the stage of the pregnancy when the infection occurs. So what lessons have we learned from other congenital viruses? Basically, the presence of the virus on the maternal placental surface doesn't indicate there's placental infection. For vertical transmission to occur, there needs to be a breach of the placental barrier. And then when there's viral infection of the placental cells, this doesn't necessarily mean that there is transmission to the fetus. And even when the fetus is infected, the responses are heterogeneous and fetal damage is not always implied. So with this background, we can now look at how SARS-CoV-2 affects the human placenta. And the data essentially consists of a series of case reports examining the effects of the virus on the placenta. We know that in the lungs, SARS-CoV-2 uses the ACE receptor to enter cells, and serine protease TMPRSS2 is implicated in cleaving the spike glycoprotein to allow fusion of the virus to the human cell. So in the first trimester, there is expression of the ACE2 receptor as well as TMPRSS2 in the trophoblast of the blastocyst and the syncytial trophoblast and hypoblast of the implantation stages, which raises the possibility of vertical transmission early on in the pregnancy. It is, however, noted that expression of ACE2 and TMPRSS2 is not as abundant in placentas in the second and third trimester, and so the exact mechanism of vertical transmission is still quite unclear. If we look at mid-trimester specimens, there are two case reports that seem to be important. The one was following a spontaneous loss at 19 weeks, where PCR positivity was demonstrated on swabs and placental biopsies. And the second was a medical termination of pregnancy at 22 weeks for severe preeclampsia, where viral particles were found in the cytosol of the placental cells, but unfortunately there was no viral expression in the fetus. Under electron microscopy, both these placentas showed evidence of intervillositis, of which the etiology is completely varied. It may be idiopathic, it may be autoimmune, or it might be induced by any other infectious agent and not necessarily by SARS-CoV-2. So here we have two different histopathological specimens of placentas under electron microscopy. And on the left, we see evidence of velitis, and on the right, intervillositis with microabscesses. And I'm sure all of us probably need a refresher in histopathology, but those dark purple cells are neutrophils, and we can see that there's quite dense neutrophil infiltration in both these specimens. So if we look at the effect of the virus on the placenta in the third trimester, there's quite an important case report by Vivanti et al. And essentially this case revolves around a 23-year-old premigravida who was admitted to a university hospital in France in March of 2020 at 35 weeks and 2 days of gestation. She was PCR positive on nasal and vaginal swabs, and she was critically ill with evidence of multi-organ dysfunction. She underwent emergency cesarean delivery under a general anesthetic, and amniotic fluid was collected prior to rupture of membranes. Both placental swabs and amniotic fluid tested PCR positive, and the placenta showed evidence of perivillous fibrin deposits and infarction with intervillocytis. The neonate was essentially born in quite a poor condition with an initial Apgar 4 and was intubated and ventilated, but was PCR positive on nasopharyngeal and rectal swabs 1.5 hours after delivery. And bronchoalveolar lavage performed on the neonate was also positive. In a second series, 20 placentas from SARS-CoV-2 positive mothers were examined between 32 weeks and 40 weeks of gestation, and 50% of these placentas showed signs of fetal vascular malperfusion or fetal vascular thrombosis. However, there was no control group for comparison, making these findings quite difficult to interpret. And essentially, most of the findings were low grade and could be related to other etiologies. Thirdly, 16 placentas were examined from positive mothers between 16 to 40 weeks gestation. 11 of them were acutely ill, and 5 were diagnosed early in the pregnancy. And 80% of the third trimester placenta showed evidence of maternal vascular malperfusion, a statistically significant higher proportion when compared with pathology reports from historical controls. However, pathologists performing the examination were not blind to the SARS-CoV-2 status of the mother, as the pathological examination was indicated by maternal SARS-CoV-2 infection in the majority of cases, and histological signs of placental vascular malperfusion are somewhat subjective, so these findings need to be interpreted with caution. And so to finalize our discussion about the placenta, we'll take a look at a systematic review titled A Message from the Human Placenta, where they concluded that further research is required, including standardized examination of placental samples from women with SARS-CoV-2 and matched negative controls by pathologists unaware of SARS-CoV-2 status to verify these preliminary reports of potential vascular and thrombotic effects in the placenta associated with maternal COVID. In addition, these findings should be correlated to the clinical status of the fetus, as well as longer-term follow-up of those neonates. Okay, so we're back with the pugs. This is Penny, and she is a puppy at this stage. And quite interestingly, pugs do have a higher caesarean section rate in labor, and that's because they form part of a group called brachycephalic breeds. And if you look at their faces, you'll see why. Their heads are quite broad and their faces are quite flat, and so their mummies often have poor progress in labor, and this usually results in an emergency caesarean section, which is very traumatic for both the mother and the owner. And so Penny was born by a caesarean section. So now we get down to the real question: is there vertical transmission of SARS-CoV-2 from the mother to the fetus? And as previously mentioned, infection of placental cells does not necessarily mean that the fetus is infected. There have been 15 studies reporting neonatal infections of those born to COVID-19 positive mothers, and of those 15, only 5 of them have reported positive neonatal cases. In many of these reports, it's quite unclear whether the neonatal infection occurs in utero or during labor and birth, or from infection from the infected mother or asymptomatic hospital staff after birth. Interestingly, 2 studies, both from China, have examined antibody titers in neonates born to COVID-positive mothers, and they found increased concentrations of IgM and IgG for SARS-CoV-2 in these neonates. So we know that IgG can pass over the placenta, but IgM is unable to pass over, and its presence implies vertical transmission. But all of these neonates were asymptomatic and PCR negative. So again, we look at the systematic review regarding vertical transmission of coronavirus, and they looked at 39 cohort studies or case series. And they found maternal fetal transmission in the third trimester to be 3.2%. And this was derived from neonates who tested positive on nasopharyngeal PCR postpartum. The rate of PCR positivity on placental specimens was also in that range, 7.7%, and the rate of PCR positivity on cord blood is 2.9%. That compounded with IgM positivity in the fetus of around 3.7% suggests that there is vertical transmission in the third trimester, albeit at a low rate. They have said that Vivanti et al., the case we discussed earlier, is the best evidence of vertical transmission, and this really only is one case. So they've concluded that vertical transmission is highly likely, but more research is required to uncover the mechanism. At Tigerbird, we have unpublished data which is undergoing review, but there are no confirmed cases of vertical transmission at the moment. So what about pregnancy and perinatal outcomes? There is a systematic review assessing maternal and perinatal outcomes in patients with coronavirus infections. So this includes MERS, SARS, and SARS-CoV-2. And essentially this review was conducted whilst the number of pregnant COVID-19 cases was still quite low. Preterm births appeared to be higher than the general population for the SARS-CoV-2 group, but they did not specify whether these were iatrogenic or due to preterm labor. The cesarean delivery rate was also quite high at 57%, but here it was unclear whether this was for a fetal or maternal indication. Fetal distress was at 25% of cases, and perinatal deaths amounted to 1.2% of cases. And at this stage, they had no confirmed cases of vertical transmission. It seems that just as we're becoming comfortable with what we think we understand about the current COVID or SARS-CoV-2 strain, a new strain comes along which looks a lot like the previous one, but is slightly different. And that is my little pug. Her name is Philippa, or Pippa for short. So finally, maybe just a word on COVID-19 vaccines in pregnancy. There is extensive data to show safety of vaccines for both the mother and the fetus for other viruses like RSV and H1N1. But up to date, pregnant women have been completely excluded from vaccine trials in the development of novel vaccines against SARS-CoV-2. The Society for Maternal Fetal Medicine strongly recommends that pregnant and lactating women should have access to vaccines in all phases of future vaccination campaigns, and especially pregnant healthcare workers who are considered a priority for vaccination should receive the vaccine. Considering the increased risk of mortality and morbidity of COVID-19 in pregnancy, it would be completely unethical to withhold vaccinations from pregnant women. And finally, to end things off, I know that the last year has been a roller coaster ride, but to quote my favorite South African influencer, Baba Musia, or Demi Debbie, as some people might know him, tough times never last, only tough people last.